Hi, I'm Lynn Wolf. I obviously play softball and I like to do puzzles, a lot of puzzles.
I'm Elizabeth Jacks. My outlook on life is very positive, and I've always been that goofy, crazy, fun Liz.
I'm Jackson Larson. The main focus on my channel is to show people in wheelchairs that there are so many things that they can do.
A little over 7 years ago, I broke my back and a lot of other things.
Emotionally, I think I was a mess, really. It was hard to believe what had happened.
I think the biggest thing is just thinking of how people will perceive me, because I feel like I'm the same person. I'm just sitting in a chair.
I was angry for a long time. And when I let go of that anger and started to embrace the challenges of things you never think of, like bladder and bowel control, and the way my life would change when I started to embrace that, things got better. Neurogenic bladder means you can't really feel when your bladder is full and when it needs to empty.
I developed my neurogenic bladder condition about 6 to 8 months after my spinal cord injury.
I was having leakage and I would have to cath more frequently. The first time I met Dr. Elliott, he was telling me just kind of the definition of a neurogenic bladder, things to expect.
When I talk to people with spinal cord injury, one of the things that bothers them most of all the things that they are trying to manage is their urinary leakage. Almost every spinal cord injury is going to have some element of neurogenic bladder. Immediately after a spinal cord injury, everything below that level of the spinal cord injury is not getting input from the brain. Over time, as the bladder feels urine in it, it starts to just squeeze whenever it wants to. This we call spasticity of the bladder. This starts to develop about 3 months after the spinal cord injury.
My trunk closing device. The biggest challenge would be that I do now schedule my life around my bladder function, and there's not really a way I can change that.
Being out in public, being with friends, even sleeping through the night, that's troublesome.
So this study is a randomized trial of putting in a nerve stimulator. We want to put this nerve stimulator in within 3 months of the spinal cord injury. Our theory, or hypothesis, is that if we can stimulate those nerves early, we can block the spasticity from ever happening. The ultimate goal of this research is to learn more about how we can stop it from developing so that we can improve the quality of life of people with a spinal cord injury and keep the bladder problems from getting in the way of them doing all the things that they want to do.
If I had the opportunity to participate in this trial, I would do it hands down.
It's an opportunity to help a condition that is likely going to become an obstacle.
I think the importance of research is that you're helping the future spinal cord injuries that come, and I think every piece of information helps.
Everybody. So if you have recently experienced a spinal cord injury, we understand this is a very difficult time for you. But we also recognize that if we act early, we may be able to prevent the effects of neurogenic bladder. Your participation in this study also has the potential to benefit the quality of life of others affected by spinal cord injury in the future. We hope you'll consider taking part in this study, and we look forward to the opportunity to share more information with you.